In an enlightening interview on ITV Gold, Dr. Rakhee Vakil shared the outstanding role of homeopathy in acute cases such as viral fevers, dengue, chikungunya, hair fall, herpes zoster, kidney stones, tonsillitis, abdominal pains, and headaches. She emphasized how homeopathy also supports critical patients in the ICU with medicines administered through olfaction or applied on palms and soles, showing brilliant results. Dr. Vakil highlighted that natural side effect free treatments can significantly improve quality of life even where other therapies have limited action. Watch the excerpt and stay tuned for the complete interview coming soon on ITV Gold. Homeopathy often emphasizes treating the root cause rather than the symptoms. How do you help patients understand this difference, especially in a fast paced world that wants instant results?
So basically, every person who has health issues do not come from nowhere. There are a lot of aspects to have any disease in your body. It starts with the mind, then circumstances, and eventually infection. Infection is pretty much in the air and anyone can contact it, but if there is a certain immunity in your body, every person will not catch infection. So if somebody sneezes in a train, there could be around 60, 70 people around that person who sneezed, and maybe only 2 or 3% will catch the infection. The other people can go scot free. So it depends on your immunity level as well, and how you think in life, what are your circumstances. Your mindset is a very important part of homeopathic treatment. We give the most important to your mind, your mental symptoms, and how you talk, how you think, how you behave, all of those things. That is a very crucial part, and we give most importance while we're taking the case. So we take the mental history, and it's given topmost importance in homeopathy.
You've treated a wide range of conditions from hormonal and gynec issues to kidney stones and skin disorders. Could you share a memorable recovery story that reaffirmed your faith in homeopathy?
There are a lot of patients who come with dysuterine bleeding and heavy periods. There are a lot of factors to heavy bleeding. It's just not one fibroid, or there could be endometriosis. There are many, there are just genetic hormone imbalance because of which patients bleed heavily. There is nothing particular that you can say, but you have to screen the patients through everything and start the treatment. And we have a lot of cures in a lot of conditions which are surgical, and it reverses completely. We have records, we have patients, interviews taken after their treatment, before treatment. We have sonography reports to show that they had fibroids and stuff, and it melts away. We have treated menopausal disorders. Hormonal imbalances are so rampant these days that, I mean, out of 10, maybe 6 girls have PCOS. So there are these cases which we have to take it up and treat them naturally. Otherwise, the doctors usually put them on OC pills and hormonal, to balance out their hormones, kind of.
Name some of the menopausal disorders.
Menopausal disorders, as in you have hot flushes, you put on a lot of weight, you put on weight around your abdomen, you have water retention, you have swelling of feet, you get very irritable. You have a lot of hair fall, and
all this can be reversed?
everything can be reversed. And every patient will go through a different set of symptom in menopause. It's not that these are the standard ones.
It's not like your menstruation will start again, right?
Menopause is like, say, 1 year of no menstruation. So sometimes it may just say hi, hello in between and disappear again. But exactly, say, a period of 1 year of no menses will be a set of complete menopause. So definitely we have a lot of scope in treating menopausal women, because that's another phase of life where patients start having joint complaints, hair fall, loss of self-esteem, and
The weight gain that can be reversed.
depression. Everything is all connected to each other, and it matters because menopause is, going through such a phase where usually the children are also in their teens. So there is a lot of conflict that happens in the house because of the hormonal imbalances that happen.
True.
And there are many women who don't understand what is going in their body, and they do not accept it because they've been working so much, and one point of time their output reduces suddenly and they feel कि I am doing everything so normally, why is this happening to me? And they don't understand that they need that pause and they need that space to combat all the symptoms and go through the phase smoothly. So one must consider taking homeopathy for menopause because firstly it is very natural, secondly it has no side effects.
So is it like a supplement one needs to take forever?
No. Supplements are totally different. Like if there is a deficiency, say you have a B12 deficiency or if you have a vitamin D deficiency, okay, the doctor prescribes you something, that's a supplement. But these are medicines, and medicines are not always drugs or chemicals which you require to take. These are simple treatments which are very, very natural and they balance out. So what happens in this is that we do not give you direct hormones. We tap your hormone system to function in a natural way. So it takes a little while because there is no spoon feeding done. So we tap your immunity to work in a way, we tap your hormones to work in a natural way. That is the difference, that we tap your system to function naturally.
Talk about the connection between mindset, immunity, and lifestyle. What are some simple reset buttons people can press daily to achieve that balance?
Mindset, immunity, and lifestyle is all interconnected, and every person should give health as a priority if they want to achieve their goals and fulfill their dreams. Because I always tell every patient of mine, health is not an overnight story, it is a journey. And if you want to reach the destination nicely, each and every day will be equally important. So if you happen to go to a party and indulge in something, no harm, indulge, be happy, but you have another week to follow wherein you can patch up those, flaws that you've had over the weekend, kind of. So, I mean, health is in your hands, and you should live with positivity and eat healthy, eat in proportion. You can indulge, but proportion is the key. So, if you get into something which is beyond limits, for a day, then you have a day beyond to, balance it out. But wherever there is an imbalance beyond a particular point of time, then the disease sets in. Dis-ease. So your body is not at ease. And every body will give you an alarming signal. And if you overlook that time and again, then you will throw up with symptoms left, right, and center.
Wow.